So here are some common signs of drug addiction. One of the first things that you may start seeing is some behavioral changes. You may start feeling like they're starting to keep more secrets, so they have like an increased secrecy in them. So they don't want to tell you as much. They're holding back. You can tell something is off. Another thing is like social withdrawal. So you may start seeing them pull away from some friends of theirs. You may see them pull away from you. You may also start seeing them decline in some of their responsibilities. So maybe they're not going into work as much. So maybe they're calling out sick. Maybe they're just not doing as many chores around the house, or they're just not cleaning their house as much. So you might start seeing that decline a little bit. You may also start seeing some physical symptoms, so changes in appearance. Some of that depends on what drug they are doing. So if it's alcohol, you may start seeing them be a little bit more puffier. If it's something like either some sort of opiates or stimulants like cocaine, meth, you may start seeing them shrink a little bit, so start getting skinnier. Um, Sleep patterns. Maybe they're just way off in some of their sleep patterns. Maybe it used to be that they would get up at 8, 9 o'clock in the morning, and now they're staying awake all night, sleeping all day, and their sleep patterns just seem a little off. So you may start seeing some of that. Health issues. They just feel like maybe they're going having to go to the doctor a lot because they're sick all the time, coughing a lot, bloody noses, if they're rubbing their nose a lot, if they're scratching a lot, different things like that. That can sometimes be a symptom that maybe they're on drugs of some kind. There's also some like emotional and psychological signs. So you may see mood swings. They may be really happy and then get really angry really fast. You may start seeing them have a little bit more paranoia and anxiety. They may also have some financial issues. So, unexplained financial problems. It's like that they're making enough money to support themselves, but you don't know where all of their money is going. Or maybe they're not even making enough money to support themselves, but you're still trying to figure out, well, where is all the money you are making going? I don't understand. Like the math isn't mathing here. So you can start seeing a lot of that in a lot of ways. You may also see them have some like increased intolerance. So, again, it goes a little bit with the mood swings where their ability to tolerate things, it's just not there. The other thing that you may start noticing is that when they are like either drinking or maybe they're just doing other substances that you'd think is not that big of a deal, but you start seeing them have an increased intolerance in that. So maybe you're like, wow, you're drinking a whole lot and you're able to like keep it together a little bit more. Like you should be flat on your back as much as you're drinking, right? You may also start seeing some like withdrawal symptoms. That a lot of times goes a lot more into like heroin has withdrawal symptoms. Alcohol definitely has withdrawal symptoms. Meth has some withdrawal symptoms. Each one of them are different. So here's how you can approach this though, because it's also different and very dependent upon what you're using or what they're using. You should probably try to, educate yourself a little bit on what are some of the symptoms per each of these things. So if you're just still in that trying to figure out what's going on, kind of make notes of what is it that you're seeing and then educate yourself. You can Google it. My best advice, though, really is to reach out to someone like myself who may be able to kind of give you a little bit more pointed of like, oh, these are the symptoms that you're seeing. This is probably what it is. I've been around this for so long. I'm in recovery myself. I know a lot of what it looks like. I'm not a I can't promise perfection, but I can give you a little bit extra guidance and a direct approach into maybe what it is that you are seeing. So I would really encourage you to reach out to my organization, the Recovering Family. All of our services are donation based anyway. So just having a simple phone call with someone like myself that really doesn't charge you anything can be really beneficial to kind of give you a little bit more of a pointed direction. If you want to know like how to really kind of bring this in and approach the situation, you're also going to want to look at choosing the right time and place, right? And that can sometimes be challenging. Again, this is where I would definitely reach out to my organization, the Recovering Family. Because when you're having the conversation, you really want to express concern and not judgment. And sometimes that can be fairly challenging to understand the right language to use. You definitely want to encourage professional help from them, but it's always good to also be able to have a professional that you can send them to, which is something that I can help with. And one last thing is you want to be prepared for resistance. You don't be surprised if they push back on you. That's just part of the game. So you're going to see some resistance, but if you want to really understand how you can support and how you can help them and how you can go about this, I would really encourage you to reach out to myself. There's other organizations as well that does some similar things that I do. So always just feel free, like you have a place that you can come and talk to someone who's been through this stuff and just figure out what you can do in your next best move. So I really do hope to hear from you soon. You can set up an appointment. You can go right to the website of the recoveringfamily.org. You can schedule things and you can also just directly call. The number is on the website of the recoveringfamily.org. Anyway, have a great day.